Let's talk about what your time looks like leading up to the surgery, the day of surgery and the day after. Though please remember, all surgeons will have their own advice for their patients and their procedure, so be sure to follow up on those guidelines. Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacements. So, you've made the decision to go ahead with the operation. The next stage is to sign the consent form. In signing the form, you acknowledge there are risks to a joint replacement, and your signature confirms that you understand those risks and you've discussed them with your surgeon. As a recap, I recommend you review the risks and complications episode in this series. In prepping for surgery, it's a good idea to get yourself in the best shape you can be. Being your best self will decrease the chances of infection and complications and improve your recovery time. Eat a healthy and diverse diet. If you're overweight, try to lose as much weight as you can before the operation. If you have diabetes, try and control your blood sugars as best you can. If you need to, go and see a diabetes nurse or an endocrinologist. If you smoke, try your best to stop or at least cut down before surgery. If you take blood thinners, even aspirin or stronger thinners like warfarin, you must tell your surgical team. Tablets such as blood thinners may need to be stopped several days in advance. If you forget to stop them, your operation may be cancelled. If you take blood thinners for something like a previous blood clot or a heart valve, your family physician or blood doctor may recommend you cover this period with an injection. If you have any allergies, please do mention them to the team, even if they seem not important to you, like eggs or soy. Please mention any drugs you take, whether they're prescription, over-the-counter, herbal, or recreational. We're not here to judge you. We just must know because certain drugs may affect your anesthesia and your surgery. In your visit with your surgeon and anesthesiologist, you must tell them your previous medical history and medications. Some of it may affect your anesthesia and your recovery. If you have an inflammatory condition, that's conditions like rheumatoid or psoriatic arthritis or ankylosing spondylitis, it may be an idea to phone your rheumatologist to let them know you're going for surgery. They may have advice for the operation. If you take a drug for one of those conditions, let your surgeon know as it may affect the timing of your surgery. If you take steroids, please let the surgeon know. Steroids can really increase the risk of infection and risk of blood clots. So this is important information for the team. An anesthesiologist or anaesthetist is the doctor that ensures you're pain-free throughout the operation. They'll also help you with post-operative or after-surgery pain control. You may meet with your anesthesiologist before surgery. This is the time to discuss your anesthesia and pain control for after the operation. On the day of the operation, we usually ask you not to eat anything for around 12 hours before the scheduled time of surgery. Many anesthesiologists will allow you to have clear fluids up to 4 hours before the operation. That clear is really important. No coffee with milks or creams, no juices. So please check with your anesthesiology team. There are two main approaches to providing anesthesia during the operation. You could receive a general anesthetic or a regional anesthesia, like a spinal or epidural. There is no right or wrong way. It comes down to the choice of the anesthesiologist, as well as some input from you. Both methods make you pain-free, just in different ways. I'll talk you through the two techniques and the risks and benefits of both. You're probably familiar with general anesthesia. I bet you've seen it on TV when people go under for most operations. A medicine is injected into your veins through your IV, or you breathe it in. This medicine makes you sleep heavily and you don't feel anything that goes on during the operation. While you're asleep, your anesthesiologist may pass a tube into your mouth and along your windpipe. This is to get as much oxygen as you need into your lungs. The anesthesiologist will monitor you really closely through the operation to ensure you stay asleep just as long as you need. When the operation is over, they simply turn off the medicine and you'll wake up. The anesthesiologist will ensure you have enough painkillers to make you comfortable when you wake up. You can definitely feel a little tired when you wake up. This usually passes fairly quickly. Some people feel a little nauseous or sick, but we can provide meds to help with that pretty quickly. Some other rarer risks are dry mouth, shivering, sore throat or raspy voice, itching, and very rarely some people feel a bit confused. The other option is a regional anesthesia like a spinal. A regional anesthesia is when an area of the body is numbed completely for a period of time. An example is when pregnant women give birth and they get an epidural. In hip and knee surgery, you're usually numb from the waist or the belly button downwards after a spinal. When a spinal is performed, you'll be either laying on your side with your knees tucked up, or you sit off the edge of the bed and lean forwards. The anesthesiologist will clean the skin on your back with an antiseptic, and then they'll inject local anesthetic on the skin. This feels a bit like a bee sting, nothing more. When the area is numbed, the anesthesiologist will pass another very thin needle into the middle of the numbness through the skin, the tissue, and then past a ligament. They'll reach an area where they'll inject a small amount of local anesthetic. The needle is then removed. After a few minutes, the lower half of your body is completely numb. The numbness starts at the toes and continues just above the waist. Not only are you numb, but you won't be able to move your legs either. One of the advantages of this process is that you'll be breathing for yourself throughout. There's no tube shoved down your throat. The numbness will last between 2 to 5 hours. Lots of my patients are horrified by the thought of being awake, but don't worry. Even with a spinal, your anaesthetist or anesthesiologist will make you sleep as much or as little as you want. Almost everyone wants to sleep. I don't blame them. More than likely, you'll have the best sleep you've ever had. When the operation is over, you'll be taken into a recovery room. The spinal will wear off slowly and you'll start to regain feeling and movement. If you start to feel pain, please just ask the nurse to give you some painkillers. Risks with regional anesthesia are pretty unusual. You may get a headache or experience low blood pressure. If you get a fuzzy taste in the mouth, feel dizzy, or develop a fast heart rate, you need to tell your anesthesiologist. In knee replacements, the anesthesia team may also do other blocks to help with the pain management after the operation. In these, they find the nerves that run around the knee and will inject local anesthetic again. These are often long-lasting. Sometimes they'll leave a catheter in to give even longer-lasting pain relief. As the surgeon is finishing off the joint replacement, they'll likely add more local anesthesia. This is as important part of a rapid recovery as it really helps with the pain. Afterwards, you're going to be monitored in the recovery room until you recover all your movement and feeling. When the recovery team are happy with your blood pressure and your pulse, and assuming you do not feel sick, you'll leave the recovery room. If you're going home the same day, you'll be sent to the discharge lounge. If you're being admitted, you'll go to a ward. In the discharge lounge, you'll meet with a physiotherapist. You'll practice getting up. You'll be taught how to move with a support aid like a walker or crutches, or if you're feeling great, canes and a walking stick. We will show you how to go up and down stairs and how to get in and out of a car. Making sure you're safe to go home is very important to us. And remember, you won't be sent home until you and the whole team feel you're safe to do so. If you're being admitted, all this will happen the day after while on the ward. Before you go home, you should voice any concerns or fears. You will be listened to, don't worry. You'll be given either a prescription for medicines to take to your local pharmacist or the meds themselves. Medicines that you get will be a mixture of painkillers and blood thinners. Once again, it's important to make sure someone is there to take you home, not only for the drive, but also to ask questions you may have forgotten to ask. Take the contact details of your physician's office as well as the details of anyone you can contact after hours. Remember, this joint replacement is your procedure and we are here to take care of you and make you feel safe all the way through. Joint recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.